Hi, I'm Sigfried Aragona. I'm the Prevention Clinical Associate with DHH, and I'm here with our injection mannequin, Miss Rosy Cheeks, to demonstrate how to do a Cabotegravir injection for PrEP. Now, Cabotegravir is used every 6 months. It is a 3 milliliter injection given in the gluteal muscle. So we'll go over what is in that kit today. So let's say Miss Rosy Cheeks just got here for her appointment. It is time for her Cabotegravir injection. And luckily, in the kit, we already have some supplies. We have our vial of medication that does not have to be refrigerated, so you can get that out of your room temperature storage. We have a vial adapter, we have our syringe, and we have a needle. Along with that, you also want to get other supplies from your office. You want to get a gauze pad, a alcohol wipe, and some Band-Aids as well for the patient when you are administrating it, and some gloves as well. So, when we are preparing Cabotegravir before seeing the patient, you want to give that bottle a good shake, make sure that there's no particulate, it's not discolored, and then you can go ahead and wipe off that top with an alcohol PrEP pad. And then we'll use our handy dandy vial adapter that comes included with the kit. As you can see, there's a little sharp point there, so just be careful. That will push through the vial like so, and that will attach onto the top of the vial like that. Once you have that connected, you want to draw up some air in your syringe. It's going to be a 3 milliliter injection, so you want to draw up 3 milliliters of air and attach that to your vial adapter. Keep it straight like that. Once it's fully attached, you can turn that upside down, push that air in, and then let it do all the rest. And then you'll see a milky white substance medication come through the syringe and start to fill it up. And just make sure you're at that 3 milliliters, and then flick away those bubbles if you see them, and then adjust this as you need to get that dosage right. Turn that back, and then you can detach that. And then you can go ahead and snap on your needle. Make sure you got the rest of your supplies to go see your patient. And then you can walk on in to see Miss Rosy Cheeks. Hello, Miss Rosy Cheeks. Can you confirm your name and date of birth for me, please? Thank you. So we're gonna do our hand hygiene, put on our gloves. Because this is a gluteal injection, we wanna make sure we are finding those landmarks on the body to make sure that we are getting to the right location. So with a gluteal muscle, you want to find the pointy part of the pelvis, which is going to be in the front hip part, and put your thumb there. Just remember, when you're doing this trick, your thumb is always facing the direction that the patient is facing, and the pinky is facing the same direction that the buttocks is facing. So you want to put your thumb on the upper pointy part of the pelvis, and then put your index finger on the other superior part of the pelvis there that you feel protruding. And those are your two main landmarks, so you can spread your fingers. Obviously, depending on different bodies, different body compositions, this is gonna vary a little bit, but you wanna shoot for the outer upper quadrant, sort of near the hip, where you can feel firmness, where there's muscle. And once you find that spot, I personally like to just give myself a visual marker and just place the Band-Aid preemptively, like right there, so I don't lose my spot. I get my alcohol PrEP pad ready, my gauze pad ready, our medication ready, and then we go ahead and clean the area. Let that dry. Let it air dry, you don't need to blow on it or fan it, just let it do its thing. And the important part about this gluteal injection is that we are doing our Z-track technique. That means when we are doing the injection, we just want to stretch the skin out as tight and taut as we can. That way we displace any fat tissue, and the needle can go straight down into the muscle without it hurting the patient too much, and we are getting to the right spot. So that alcohol's drying, we let down that guard. We're making sure we Z-track, and then just take off that guard, pull back that skin, and we're gonna go in at a 90-degree angle into the skin. So If this were a real needle, this would go all the way through, but for demonstration purposes, Rosie gets it easy today. We go all the way through to the muscle and push all 3 milliliters in. It might be a little viscous, so you just want to go slow for the comfort of the patient. And when that's done, you're going to release the skin and pull out the needle at the same time. There might be some leakage, in which case you just put a gauze pad over that, and you just want to make sure you guard your needle and dispose of it correctly in your sharps waste container. Whenever it is done bleeding or there's no more leakage, you can go ahead and take your Band-Aid that you preemptively placed right there and put it over the injection. All right, and Miss Rosie Cheeks did a great job. Make sure she's scheduled to see the clinic again in 8 weeks or 2 months for her next Cabotegravir injection.